Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about why, for a lot of people, does the knee replacement recovery and rehab feel like it just takes so long and is so slow. Before I jump into that, be sure to hit the subscribe button, turn on the notifications to catch all of our latest videos. So, if you're feeling frustrated, you feel like your recovery is not progressing, you're plateauing, it's just taking such a long time, you're definitely not alone. This is a normal problem, a normal concern that many individuals have after knee replacement surgery. What we want to think about, we can't speed up tissue healing. We can't speed up the healing process. So when you have a normal, rough estimate, the first week or two of knee replacement, we're dealing with swelling, pain, discomfort, and we're just trying to get you mobile, get you so you're able to walk, make sure we're managing pain effectively, and getting that early knee range of motion, straightening, extension, as well as the bending and flexion. From then on, the weeks 3 to 6, 3 to 8, we're really focusing and really hitting that range of motion, getting your knee bending, getting your knee flexing, and extending to perfectly straight. We're building up strength, and we're just building up your function and your mobility to be able to do the things that you need to do. Walking, stairs, standing, all those important things. And then really the bulk of your recovery is after those first, 6 to 8 weeks. The full rehab and recovery can take, 6 months, more than 6 months, 8 months, a year, even a little longer for some folks to really feel like you're fully and completely recovered. I always say that last 10 to 15% of your recovery really can take the majority of your recovery time is getting that last 15 to 10% back. And that's where you're returning to daily activities, you're returning to the things that you enjoy, and being able to tolerate those things and do them effectively. It's normal to understand that setbacks are going to happen. You're going to have good days and bad days. Your progress is not always going to be linear, a straight shoot up. There's going to be obstacles, there's going to be lulls, there's going to be declines. But if we look at the big picture, for the majority of folks, we will see that progress over time. But why does it feel like it's so slow? Why does it feel like it takes so long? Well, one, you're dealing with pain, you're dealing with swelling, you're dealing with stiffness of the joint. And that can be extremely frustrating. There's the physical component, but also a very significant and noteworthy mental component. Anxieties, depression, fear, frustration, all come with pain, swelling, stiffness, the symptoms that are very common and normal after a knee replacement. You're also having to deal with disturbed sleep, difficulty falling asleep, difficulty staying asleep, discomfort, unable to find a comfortable position, and that's just going to feed into that fatigue and that frustration as you rehab and recover. And also we fall into what is a comparison trap. We have expectations, we compare ourselves to others, to other people we see in therapy, to our neighbor who had a knee replacement, whoever that may be, and we always want to be progressing that level. And oftentimes we don't see those struggles that those individuals are going through or have went through as well. We only see the positive things and compare ourselves in kind of a negative aspect. And we just underestimate, the significance of what you had done. A knee replacement is a very significant orthopedic surgery. It's a very significant trauma, controlled trauma that is occurring to the bones of your leg and your knee. And it takes a lot of energy and time for that to heal and recover. And, that's something that it's hard to be patient as we allow for that process to occur. So what are some tips, what are some things that you can think about to stay encouraged as you go through this process? One is focus on the milestones. Focus on the functional improvements and gains that you make. Don't worry too much about where you are on, 6 weeks out, 8 weeks out, whatever that may be. Think about, Oh, now I'm able to go up and down the stairs. I'm able to get up and down from a chair easier. I'm building strength. I'm building my range of motion. Focus on those improvements and those gains over time, and don't necessarily look at the calendar and where you are and compare yourself to others. Focus on keeping your symptoms under control. So pain, swelling, stiffness, this is all kind of the nature of the beast when it comes to rehab and recovery after surgery. But there's many strategies out there to stay on top of your pain, to manage swelling, manage that stiffness as best as we possibly can through a variety of different techniques. Medication, ice, heat, compression wraps, electrical stimulation, all sorts of different things to manage those symptoms at least as best as we possibly can. And that's going to improve your ability to tolerate things. It's going to reduce your frustrations as you're rehabbing and recovering. Another thing is consistency, consistency, consistency. You don't want to go out there 0 to 100, the most aggressive exercise every time you do it. You're going to burn out, you're going to get increased pain and stiffness and symptoms, and you're not going to have that motivation for the long-term recovery. Focus more on being consistent, doing things at a moderate to slightly higher than moderate intensity consistently. That's going to see the best improvements over time, and it's going to allow you to keep doing your exercises, doing those activities day after day. Celebrate the small wins. Remember, focus on those small wins, those functional improvements that you get. Things that seem, not even something that you even think about, like getting up from a chair, getting in and out of bed by yourself. Those are going to be those small wins throughout your rehab and recovery that you need to celebrate, and remember that you are making some positive improvements. And when in doubt, if you're really frustrated, really having concerns, be sure to use your team, your healthcare team. Talk to your doctor, talk to your physical therapist. Maybe it may lead to a referral to another professional, such as a psychologist or psychiatrist. Maybe it is a referral to an occupational therapist, a fitness coach. Whoever that may be, use your team as a resource if you're running into these roadblocks and having these concerns. So I hope this was helpful and insightful. Again, and as always, please be sure to hit that like button. Please be sure to leave your questions and comments below. Thank you very much for watching.